All right, so today we're going to talk about the spiral line. It's my favorite line because it's a functional line. Because when I ask people to do something, to rotate it, I can see how, like which way is a spiral line is not working. Let's memorize what's the spiral line. I'll just get this little bit bullet points. The spiral line, it's of course, fascia kinetic chain that wrap around the body in the spiral pattern, like a DNA, and it starts in your neck, in the back of your neck, right in here, and it's go wrap around your shoulder. It's go under your rib cage, go to your hip, go right around this leg on the side, on lateral aspect of your leg, go to wrap the leg around and return inside and go up to your erector muscles, all the way up to your skull, right in here. And this is the spiral line. And it's also come from the other side, and it's crossed your body twice. It's crossing on the back between your shoulder blades and in your abdominal area, right in here, like a two axis. Guess what? When you see people come like this to you, you see that space is shorter up here. What's happened to them? The spiral line, right? The spiral line is not there. It's not something is pulling. He dominated one side, and you're gonna massage it. What's gonna happen? He might feel better. You might open this up, open that fascia, working on that line. And 2 weeks later, he's come back. He's the same, because he's constantly moving the same pattern over and over. Whatever job he do, I don't know. Like we have a massage therapist who's always standing this way, you see, and it's create that energy this way. So it's rotate his torso that way. He never doing this way. But if we retrain that kinetic line, it's gonna balancing him and take this pain away. So same with the clients. Always look at those kinetic line. Also, what's this function of this kinetic line? It's most of the time it's a rotation in our body. So for the athletes, for people who's doing the job, it's rotation. We all do rotation, 100%. We do rotation. Only if I have this job, when I came to the United States, I was sitting like this, and it's a cans was coming. And if this is bad can, like a bigger can, like pushy one, I have to take it off and put it away. And I do this for 8 hours. Can you believe I was sitting like this and it just come? Was the job. Was most crazy job in my life. Sometimes I see illusion, something like different comes in that line, and yeah, not good. Maybe if you're doing this kind of job, you don't have a problem with your spiral kinetic line. You might have a front line because you always lean forward, and that's going to jam this area. So rotation. Next one, it's maintenance across the body. Also stabilization your body in dynamic and rotation of sport and movements. Also control oblique and diagonal motion. So that's is what you do your spiral unwind. So like I said, it starts with your neck, crossing in two crosses, and go around and wrap around this leg. I will put that pictures up there. You guys will see it. So what muscles involved in spiral line? It's sternocleidomastoid, neck of rotation, trapezius, upper fiber. Also rhomboids. A lot of people come with those rhomboids, and what people most do, they start stretching, try to find those trigger points. But if people like that, you can massaging all his life is not gonna do anything. So serratus anterior, external oblique, internal oblique, tensor fascia latae, iliotibial band, tibialis anterior, and biceps femoris. So, what does a spiral line do? It's a coordinated rotation and twisting motion. It stabilizes your torso during movements. It's help control your balance and helps control your balance. Stuff like that. Also, why it's a spiral line important for training and doing your workout or doing your everyday routine, whatever you do. It's a rotation restriction, hard to twist your torso, so that locking this mobility in your thoracic area. One shoulder higher than other, so sometimes people doing that. Why? Because Phil, if my left side is dominant, I always go this way. So it's going to rotate me this way. That's why my shoulder is going to be high. It's not the shoulder high, it's because the upper side kinetic line is being overused, dominate, and that's get you that crooked. So we're not just massaging muscles anymore. We're looking for that chain, we correct it, and we make people happier and move better. Um, Also help with the scoliosis patterns, those rotators, those spine irregular. How are you gonna say that? I mean, you know what's a scoliosis? It's a regular curve of your spine. It's a S curve or C curve. So those work as help with the scoliosis people, clients. So do this on the scoliosis people. That kinetic lines, we already been showing a bunch of them, and put the spiral line up there too. Next one, it's a hip asymmetry, hip balance, because a lot of people get this unbalance in the hip. Why? Because again, this big cross X in front of you, and if this is pull you, one side is, like I said, dominate, it's pulling, and it's create that disbalance. Also later, it's gonna create that problem in your spine. It's gonna push that jelly donuts on the side. It's going to create that sciatica, and people come to your clinic and say, oh, my sciatica. And massage therapists jump on that sciatica, start getting this, I don't know, get that elbow in the butt, and nothing. Nothing. But if you give him the bands and he start doing rotation exercise, it will correct those hips, balancing those hips, and it's going to be more productive than you just be working manually. So that's the goal. And stiff neck, because like I said, sometimes you see people come in like this. You need to work on those kinetic line, and that's the key. So how to assess the spiral line? It's a rotation test. Can be personal twist, easily both sides. Yes, like turn left and right. I'm not going to do this right now. Yeah, because I think someone did something to me today, this morning, and I feel when I'm turned, I feel that something is coming in my rib. So, shoulder balance. So, make sure the shoulder is same height. If you see the people like that, they might have this spiral kinetic line problem. Single leg standing, see how the people get in this stability. Basically, we talking about this assessment in our assessment book. This is the main exercise. Try to people reach, try to people turn, try to people breathe, and try to people stay in one leg and squat. If people can't do that, we have a problem. We have to work on that. How to activate those spiral line? Basically, it's oblique stretches, oblique pulling. We do this self massages every day. Also, hip mobility stretches, hip mobility, and what else? Cross body movements, chopping exercise, rotation exercise, all that stuff. What else? Yeah, that's probably it. But if you're a massage therapist, like I said, focus on those rhomboids, focus on the IT band. We can't do much on IT band, but we definitely can work on that tensor fascia latae and make it big improvements. Tibialis anterior muscle is important to look. If people that can move that dorsiflex and plantar flex that foot, it could be the issue too with the kinetic line. And breath. See how people breathe. I usually place the both hands on oblique muscles, and they breathe. If they can't extend to the side, that's the problem. Yeah, so definitely. And 90% is going to be there. So that's about it. Now we're going to work on those lines. But before we work, this is the best test. I saw people, therapists do this on the table. but I usually do this on the floor. David, you want to come up here? So this is called a rolling exercise, and this is how you check if your client have this problem. I want you to lay down face up. Yeah, on the floor, don't worry. You want a sheet?
No.
No? Okay. You don't care. Just kidding. Okay, so the idea is scoop a little bit this way, so you're not gonna, a little bit more. So what I'm doing here, let me just turn this more on David now. And hi there. Okay, so what we're doing here, we're doing this rolling exercise. Not that it's exercise and it's a test at the same time. So we check our upper body and lower body. I want you to get your arms above your head. Now, think about it. You're freezing your lower body. You do not move your body. I want you to roll. You can lift your arm up. You can lift your head. And I want you to roll to that side. Start with the right one. And see, you see if any kicking in the legs, and he roll back. One more time. One more time. Don't kick, just, yeah. So the thing is how slowly he can turn without any kicking, and if it's happened. What do you feel? Is that hard for you?
No.
No? Okay, try to go other way.
Other.
Yeah, the left one.
It's hard.
And you see what's happening here? It's already telling me I don't need to flip him on the belly, and he go from the back, extension of the shoulder, extension of the arm, and this is even a hard way. So if he can do this way, you see this is kind of he's trying to kicking his food. This is telling me so he's easy to rotate from right to left, right, but from left to right it's hard. So he's gonna get that something restrict him. So this is telling me this is our kinetic line is not balanced. You can do this also test with your upper body. Just think about it now. You're freezing your upper body. I want you to raise your leg like this in 90 degrees and roll with your legs now. So use your lower body to roll yourself. Perfect. No problem?
No.
Okay, switch legs. And a little bit harder, right?
Yeah, a little bit.
Little bit, but that's okay. Legs is easier. The legs is most easy. The rotate the upper body, it's the hard way. So this is what I do, but I see some therapists, they extend the arms and they kind of flipping clients. We're gonna pause this video and we're gonna bring the table. I'm gonna show you this testing, how you test people on your own, like with your arms, and David show us how to release QL muscle today. All right? And we continue work on our spiral line next. It's okay, you're gonna be a star today. Look at this, man. This hip is too high. Yeah, this one is too high. All right, are we rolling? And this is I saw in one of the classes. This is how they check this rolling pattern. So if you forgot to do an assessment or diagnosis, so all you do, like you try to people relax. And if some people, you can't even bring the arms this way, it's already telling me if the shoulder is a problem, it's something going on. So I keep this, try to relax. I'm not grabbing the wrist. You see my fingers is right kind of on that arm, like 3 finger, 2 finger, whatever your strong is. And all you do, you kind of you step to this side, you're going to roll, and you start roll, client to this side. And see how easy this roll. You see this?
Tighter on my right.
Yeah, and you release it. Now you step to the right, and you start roll. And let it go. You feel that? So people say, "Oh, what about if client's gonna dropping from the floor from the table?" Just stay kind of on the side and roll, and don't complete. You see, you roll him up here. Even here, he's still not out, and let it go, and see how he's coming back. So this is important too. So do those tests. I know. It's take your time to understand how to roll it. The customer, you're going to feel that fear. He's going to fall in the table. But practice on your friends, practice on your clients you don't like, and you go from there. But this is good testing. Uh, so use this test and see how the difference, and of course work on that. If you feel that's hard to go this way, try to help your clients. I usually put some towel, roll him better, give him this bands exercise, or even help him with the band, wrap the band around him, push this way, push the hip, push that thoracic area, help him with the neck, and it's going to help. Like I said, next class we're going to do that. But now we're going to work on this spasming QL, and also we're going to work on this serratus muscle on the side position. All right, so see you next time.